of children with cleft lip and palate anomalies are born with normal birth weight. However, because of feeding and other difficulties, the most common problem the pediatrician has to deal with is the insufficient weight gain. One of the main responsibilities of the pediatrician is to closely monitor the infant's weight. The majority of children born with cleft lip and palate are unable to be breastfed. Those with cleft palate cannot produce the negative pressure necessary for suctions. Mothers of children with unilateral cleft lip may succeed with breastfeeding when the child is positioned so that the cleft in the lip is obstructed by the mother's breast. No single right or correct method of feeding exists. Parents working together with the health care provider should choose the method that is best for their infants. Most infants can complete a feeding in 18 to 30 minutes. If more than 45 minutes is required, the infant may be working too hard and may be burning calories that should be used for weight gain. An infant who nurses or bottle feeds every 3 or 4 hours tends to gain weight better than an infant who feeds frequently for short periods. Breastfeeding an infant with a cleft. In case of isolated cleft lip, the infant typically does not experience feeding problem beyond learning how to latch on to the nipple at the beginning of the feeding. Infants with cleft palate must squeeze the milk out of the nipple by compressing the nipple between the tongue and whatever portion of the palate that remains. Massaging the breast and applying hot packs on the breast for 20 minutes before nursing usually helps. The mother should apply pressure to the areola with her fingers to help the encouraged nipple protrude. She should hold the infant in a semi-upright straddle or football position. She should support the breast by holding it between her thumb and middle finger, making sure that the infant's lower lip is turned out and the tongue is under the nipple. If the infant cannot hold onto the nipple anymore, the mother can collect the remaining milk using electrical or manual breast pump, or by squeezing the breast with both hands, and can finish the feeding with collected milk in a bottle. The mother should increase her fluid intake, drinks lots of water. Feeding milk formula with a bottle. The most appropriate milk formula should be selected by a pediatrician or feeding specialist. A variety of nipples and bottles are made especially for infants with clefts. The goal is to find a nipple and a bottle that make feeding easy for the infant and still allow ample opportunity to suck. A soft nipple is generally better than a hard nipple. Use a cross-cut nipple to prevent choking. Any nipple can be cross-cut manually by using a single-edged razor blade. The cross-cut is on the tongue side. The bottle should be squeezed and released, not continuously squeezed. The nipple is angled to a side of the mouth away from the cleft. More upright or seated positions prevent the milk from leaking to the nose and causing the infant to choke. Advise the mother to stop feeding and allow the infants to cough or sneeze for a few seconds when a nasal regurgitation occurs. A palatal